90% of Kenyans are malnourished. That is a shocking news. And this is according to a report that was published in December 2016 by the World Bank, jointly with UNICEF and other players, keen interested players. And at the same time, 85% of Kenyan children up to the age of 5 are malnourished. 50% of Kenyan women have vitamin A deficiency. Malnourishment is what is generally called the hidden hunger. People are hungry, but they feel their tummies are full. They're eating very rich foods, but not the right quantity or the right foods to give their bodies the nutrients that they need. Both the major classes like carbohydrates, the vitamins, the proteins, the fats, but especially the micronutrients, the vitamins, the minerals, the zinc. We're talking about iron deficiency that is so common with a lot of the women. How do we provide all these? The calcium, that is a big issue with both children and also women. And we have had a lot of cases, particularly of women, young women having problems with their backs. Back problems is a main complaint in hospitals and clinics. And fractures with people who are not really old, in their 40s and 50s, because of the bone density, that a lot of us are walking around with bones that are very porous because we don't get enough calcium. Unless we change the diet, the nutrients that we put in our bodies, Kenya will not have the human capital to deliver on Vision 2030 projects, because malnourishment is about both body and brain. So when one is malnourished, the body gets stunted, it doesn't grow to its full DNA capacity, and also the brains, they also don't grow, so you get fairly average and below average children. Statistics and the reports tell us that the kind of a child, both body and brain, is determined by the nutritional status of the parents. And that period, what we call the 1,000-day window, which is the period from conception to the child celebrating the second birthday, that is exactly 1,000 days. That is the most critical time for the child and the mother. This is because if there are nutrients that miss, for instance, vitamin A, which is the most critical, the effects of that deficiency, some of those are not reversible. If the mother doesn't have enough calcium, the baby will not have enough calcium. If the mother doesn't have enough vitamin A, the baby will not have enough vitamin A. You only give what you have. Therefore, for the baby to be fully nourished, the mother must be fully nourished. That is the first 6 months. And this is why you find that the most malnourished children, actually in the whole class, the most malnourished people are between the age of 18 and 24 months. So you find when they're being weaned and then they're put on foods, and the children are then being handed over to the caregivers, the maids and house helps, the children are left to eat what they want. They'll eat what the caregiver finds in the home. They'll take sodas, they'll take squashes, they'll take essentially junk. And that is where they are most malnourished. And that then determines how they will turn out as adults in their learning and earning capacities. And the statistics from the World Bank, the report we've referred to, says that we lose up to 11% of national wealth. You can say the GDP of a nation, up to 11% is lost yearly because of having malnourished people. In Kenya, 50% of women living in urban and peri-urban areas are obese or overweight, which means they have a BMI above 25. And overweight, just like underweight, is a factor of malnourishment. We eat too much of the wrong foods and too little of the right foods. The obesity and overweight is the clearest indicator of non-communicable diseases in future, whether we are talking about diabetes, we're talking about blood pressure, we're talking about cancer, we're talking about heart conditions. The clearest indicator is overweight and obesity. In Kenya, 27% of deaths of people aged between 30 and 70 is caused by non-communicable diseases that I've talked about. And this is as part of the total, where you have got malaria, you've got HIV, you've got the many accidents that we have in this country, that more than a quarter will be dying of what is preventable, is something that we have to deal with and deal with urgently. The position is the same with children, that most of the biggest number of the children that die, especially between 0 and 5 years, is because of nutrition, malnutrition, that we don't care enough about what our little children eat. And it is incumbent on every mother to really take this to heart and do whatever is possible to prevent that happening from your child. Again, when you consider the effects of this malnutrition later in life, we talked about the learning and earning capabilities of those children. You'd go out of your way to make sure that they have the right foods. In Choice Health, what we have done is to respond to this crisis ever since we knew about it going back 2011, to find products that are natural, functional, and that round off all the nutrients, put all the nutrients, the essential nutrients, in one product. And that is why we came up with the Tutti yogurt. And we then infused the aloe vera, because aloe vera is a superfood. It contains all the essential food classes, from proteins, carbohydrates, fats, all the vitamins. There's also the essential minerals. They are contained in the aloe vera barbadensis. And we put that in yogurt to produce the Tutti yogurt. What maybe many people are not aware of is that although milk is known to be very rich in calcium, most people, including adults, are not able to digest and therefore extract the calcium from the milk. But once you ferment it, which is the process that is used in making yogurt, then calcium becomes readily available. With aloe vera contains a protein, called lignin. And the only function of lignin is to give it ability to penetrate. Therefore, in addition to the breakdown of the food products in milk as yogurt, the aloe vera helps it to get absorbed into the body very quickly, so that it then goes into use in the body. So with calcium and phosphorus, and then with vitamin A, which you find vitamin N, and then you've got vitamin D, which again is very, very rare. Vitamin D and vitamin K are needed to be able to deal with the breakdown and get the body to use the proteins, the carbohydrates. All those are found in aloe vera. The milk, then the yogurt becomes a very rich product. And this is what we are offering in this product. Of course, we know people's absorption and use of those food types are different, and therefore we are working on other products that we can use so that we give people variety. But for now, we have this tutti yogurt, which is enriched with aloe vera, and it should be taken before conception in the case of women, before and during pregnancy, and even give to the children once they are off the mother's milk, because while they are suckling, they should suckle for as long as there is milk. If it's not, then supplement with yogurt. It has been demonstrated that yogurt with probiotics, which are the active life cultures, is only second to mother's milk in terms of nutritional value. And that is important for Kenyans to know, so that we save the society, because when you have got weak children, weak adults, you have a weak society. And this has been demonstrated. There are many other things that aloe vera does to the human body and mind, but those are for another day.